Good morning. I am Sarana Rebuzzi, a medical oncologist and a PhD in translational oncology, working at the medical oncology unit of Ospedale San Paolo of Savona, Italy. The title of my poster is Baseline Characteristics as Parameters of Choice of First-Line Therapy in Metastatic Renal Cell Carcinoma Patients, the METEORO 33 study. The background of this poster is the treatment scenario of metastatic renal cell carcinoma, which has revolutionized with the introduction of immune-based combinations compared with the target therapy. So now the clinical practice is characterized by the possibility of using different first-line therapeutic options. So in this context, formal comparisons between the different therapeutic options and large-scale real-world data are lacking, and few prognostic and predictive factors to guide treatment choice are available. Therefore, the METEORO 33 study aims to set up a large-scale real-world database to identify prognostic and predictive factors to help the clinical decision-making. Compare the novel prognostic score, the METEORO score, and the IMDC score, and also to assess the different response and survival outcomes and toxicity profile of the different immune combinations. The METEORO 33 study is an ongoing, multi-center, prospective and retrospective observational study of a real-world metastatic renal cell carcinoma population receiving a first-line systemic therapy according to clinical practice from January 2021, including immune-based combinations and target therapy monotherapy. About 80 Italian centers will be activated, and now about 40 centers are active. 860 patients have been enrolled. The data on clinical and tumor characteristics are collected using an online database, and statistical analysis are conducted by applying the principles of emulating a clinical trial and developing appropriate ad hoc protocols for each planned analysis. In the analysis reported in the poster, clinical and tumor characteristics were investigated as parameters of therapeutic choice. 3 different comparisons were conducted: IO-IO combination versus IO-TKI combinations, IO-IO combination versus TKI, and IO-TKI combinations versus TKI. In this analysis, at the data cutoff of April 2024, 421 patients from 25 Italian centers were assessed. 63% of patients received IO-TKI combinations, 19% IO-IO combination, and 18% target therapy. In the IO-IO versus IO-TKI comparison, a worse IMDC score and the presence of metabolic comorbidities significantly correlated with the choice of IO-IO. On the other hand, the presence of bone metastasis significantly correlated with IO-TKI. In the IO-IO versus TKI comparison, a worse IMDC score was significantly associated with the choice of IO-IO, while a higher age with TKI. In the IO-TKI versus TKI comparison, a higher number of metastases significantly correlated with the choice of IO-TKI. On the other side, a higher age, the presence of gastroenteric and renal comorbidities, and more than 2 comorbidities with TKI. In conclusion, the ongoing METEORO 33 study showed a real-world scenario of the first-line setting in metastatic renal cell carcinoma. In this preliminary analysis, some well-known prognostic factors such as performance status, sarcomatoid features, lung and liver metastasis seem not to be relevant in the decision-making. Other factors were confirmed to direct therapeutic choices such as MDC score, bone metastasis, number of metastasis, age, and comorbidities. These findings of the clinical practice will be useful for further analysis to assess the different survival and response outcomes of the therapeutic options in the first-line setting. The main limitations of our study are the observational nature, the presence of a retrospective group, and the absence of translational analysis. So, as mentioned before, these results derived from a preliminary analysis. So, further analyses are planned with a larger sample size to answer as many clinical questions as possible, including the validation of the Mituro score, the application of artificial intelligence, and the assessment of the prognostic impact of nephrectomy, clinical and tumor characteristics. Thank you very much.